All right, welcome back to our Health and More Policies presentation. As I said, my name is Holly Harpel, and I'm the CEI Healthy Communities Initiative, VISTA, in partnership with the Kansas Health Foundation. And this session's topic is mental health and how it impacts HCI network, bringing you data from a lot of the counties, as well as looking at the state, and finally, ending with recommendable policies. So zooming out and looking at our state of Kansas as a whole, about 227,906 people in Kansas in 2015 experienced serious psychological distress, and that is defined in the resource below. And that's out of a population of almost 3 million people. 21.4% of people who experienced serious psychological distress had substance use disorders. It's estimated that around $300 million of an economic burden is placed on our state due to the serious mental illness that people are dealing with every year. And kind of getting into just the factors that play in here, we have about 17.2, on a state average, we have about 17.2 behavioral health care professionals for every 10,000 residents. And that's below the US average of 19.9 behavioral health care professionals per 10,000 residents. Looking into the school setting, because that'll play into effect later when I'm talking about some policy recommendations, it was noted in 2017 that 25% of high school students reported symptoms of depression. And this is in Kansas again. 16% of high school students reported serious contemplation of suicide. Now, zooming in to some of the county data, first, talking about the highest rates of hospital admissions for mental health for every 10,000 admissions, there's about 72.7 of those. And we've got some rates that are well above that, with Reno County, from Sedgwick all the way to Reno, very high rates comparable to the average, compared to the average. And those are, again, kind of encompassing those bigger urban communities, well, with the exception of Arma in Crawford County, our HCI grantee city. But this is just very telling data that our hospital admissions are receiving a lot of people for mental health needs. And speaking in terms of the highest rates of death due to drug poisoning per every 100,000 deaths, and Kansas had a rate of 11.2 deaths for 100,000 population in Kansas. And again, rising above that average, that Kansas average, are Harvey County, Reno County, Butler County, and Sedgwick County. Now, speaking to the HCI counties with the worst ratios of Kansans to mental health providers, I would point to this as a very telling statistic of how mental health infrastructure is prioritized in the community, or is not just prioritized, but just financially reasonable for smaller communities. The Kansas average is for every one mental health provider. They're seeing about 500. They would have to service 530 Kansans. And these statistics here show that Barber County, which is southern Kansas, is experiencing in that whole county. It was reported in 2018 that they had one registered mental health provider for a county population of about 4,500 or more, almost 4,600 people. Looking at Seward County, which the number after the comma is exactly how many mental health providers that registered. And so with Seward County, that's about still 1,300, 1,300 people for one mental health provider. And that's not necessarily saying that in that number, those are all people with mental health needs. I think it's just that population ratio. And continuing on, Sedgwick County has, these numbers are more making sense, just knowing there's a lot of more providers in Wichita, in the Wichita area, and Sedgwick County. So that's about 1,000 people, and that makes that ratio 480 to 1, which is much better than the Kansas average, if you're looking at it that way. But still, you have all these top 9 counties, well, Wyandotte and Reno are together, so about 10, all above that average, that Kansas average of having one Kansas mental health provider per 530 people. Alrighty. Now, speaking to the HCI counties with the highest rates of Medicare beneficiaries treated for depression. So 18.9% of Kansas on Medicare were treated for depression. And I can't determine whether that's just prescription wise, or behavioral health counseling. But here we see that the average, these top counties, I don't know, going back, all these counties here are above that Kansas average of how many Medicare beneficiaries are treated for depression. And this isn't necessarily something that would be targeted with policy that I'm looking for, but it's just telling that, in the service population, this is the amount of people that are receiving benefits, which is good. It's meaning that these people are able to get access to the care that they need. And okay, the HCI counties with the highest numbers of people uninsured in coverage gaps, because I'll make the point that expanding Medicaid is projected to be able to increase services to mental health, people with mental health needs. So there's about 138,000 people uninsured in the coverage gaps in Kansas. And this just also shows just the specific county data as to how many people are uninsured that could be insured if Medicaid was expanded. Again, we're seeing mostly those urban counties. And another, speaking more to expanding Medicaid again, about $4 billion, it's estimated, in federal funds were forfeited since 2014 from not expanding Medicaid. And Kansas is one of 14 states that has not expanded Medicaid. And if you remember, I'm pretty sure Kansas also one of 14 states again to have a food sales tax. Now we are going to explore policy recommendations, and a lot of these were adopted from Kansas Health Institute's research, as well as the USC, University of Southern California's researchers. So just speaking to what's at play here, and again, these policy recommendations are more given because, this list isn't extensive. It isn't as thorough as it could be, obviously, but these are ones that I think that community groups, community working groups like our HCI grantees could be taking strides and taking steps to make sure that these are adopted and see how they could benefit their community. So we'll be talking about personnel in shortage areas, regional community crisis center locations, Medicaid expansion, and intervention in natural settings to benefit adolescents. So in terms of personnel in shortage areas, this is one that was taken from the Kansas Health Institute. So shortage areas are described as places with high poverty levels, an elderly and youth ratio, and this is all it can take into consideration, and the travel time to the nearest source of care outside the area. And I'm not sure what the metrics are on this, but basically what they found is that there are only about 27 full-time behavioral health care professionals in shortage areas across the state, when it's recommended that there should be about 36 more full-time employees in behavioral health care in these shortage areas, including 4 in correctional facilities. So as we remember, our state of Kansas has a population of about 2.9 million. So what this is saying is that about 48%, 1.4 million people, are in the designated shortage areas that are lacking behavioral health care professionals and have such a decrease or reduced access to sources of care. One big policy recommendation that has been kind of implemented, but is seeming like it's needing more implementation and more enforcement, is establishing or licensing centers to be regional community crisis locations. So these are kind of what you'd think when you're thinking ComCare out in Sedgwick County and also out in Topeka. And so these are just not hospitals. These reduce wait times for ER treatment and decreases inpatient psychiatric admissions. And inpatient capacity needs could also be reduced if we had more regional community crisis center locations. And you're not building these places from scratch, it seems like, in most of these cases. A lot of these places are needing the Crisis Intervention Act to be enforced more, to allow for regulations and licensing to take place. So the current centers, where this has kind of been piloted more or less, is in KC, Topeka, and Wichita. ComCare has saved their cities $8 million in ER treatment. Rainbow Services, Inc. has saved $4 million in hospital costs, $2 million in ER visits, and $75,000 in jail costs. And now the next policy recommendation to explore is the idea of Medicaid expansion. 36 states have expanded Medicaid. And in these, an interesting connection here is that in these states that have 17 to 25% of new enrollees in those other states had behavioral health diagnoses. And so when you're able to have access to Medicaid, you're able to find providers that will address the needs you have. So this improves access to clinical care, prevention, and crisis services, as they would be covered by Medicaid. And your coverage would be available when your symptoms first occur. It addresses gaps in crisis care and substance use disorder, and is estimated in Kansas, again, that there would be 138,000 new beneficiaries, all with this option. But if we're applying that same 17 to 25% of new enrollees, that's thousands of people who could be connected to services finally without that added obstacle. And this is a policy recommendation that I've seen firsthand through a friend, and I just think it's important. I know that there's a lot of HCI communities that are working with schools, in schools, from schools, with parents, and I think it's really important to talk about intervening in natural settings to benefit adolescent mental health. So when I'm speaking about natural settings, I'm including homes, schools, primary care offices in the community, and this would increase behavioral health services in schools primarily. And so the model is called the Integrated Primary and Behavioral Healthcare Model. So the last bullet has the policy that leads into the next, the bullet before that. But SB 423, Mental Health Intervention Pilot Program from the 2018 state legislature, awarded $4.2 million to 79 schools across the state, $1 million to ComCare and USD 259, which is in Wichita, 22 schools, 34, so basically this pilot program took place in 22 schools, and comprised 34 clinicians and therapists and 45 case managers. And before getting back to that third bullet point, a friend of mine actually was part of this pilot program, and she had just ended a job with me before that, and it's how she described it to me as kind of like a triad, like there's the clinical therapist and potentially someone who's completing a degree, as well as a case manager. And so altogether, they address they're working with the kids one-on-one, and really literally are in the schools being accessible to students who they identify, as well as students that are referred to them. So it's obviously been, it's being renewed. It's been renewed. I know that she is even working her second year. And so with this pilot program, it's what do you call it? It has potential, and it has proven benefits. I think if you follow that link, I wasn't able to include it in this, but what they're wanting to do now, or just the idea now, is that it should be included in additional school districts. And because school-based interventions are proven to alleviate symptoms and increase positive coping skills. And so the next video will be about housing and how it impacts HCI network data.